Hello, ladies and gentlemen. Welcome to this very important channel, Health is Wealth, with your regular presenter, Muhammad Hadi Usman, a nurse from Specialist Hospital Life here. In today's topic, we are going to look at the current pandemic issues, which is called coronavirus. And this is our topic that we are going to concentrate on. First of all, we are going to know what is coronavirus, followed by the COVID-19. Is there any difference between coronavirus and COVID-19? We'll get to know it. And what are the symptoms of COVID-19? And how does this COVID-19 spread? These are the things that by his way we are going to cover it. I wish you to stay with me till the end of this video because I want to share some bonuses that will help us to live long despite the pandemic issue or despite the problem of the coronavirus. And if you are new to this channel, please consider subscribing and hit the bell icon notification in order for you to be notified whenever we release a video related to health and health related issues. Okay, let's go. Then what is coronavirus? This is the question that we keep on asking. What is coronavirus? A coronavirus are a large family of viruses which may cause illness in animals or humans, or illness in animals or humans. And in humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. This Middle East respiratory syndrome was found in around 2012 in Saudi Arabia. That is why they name it Middle East respiratory syndrome. While acute respiratory syndrome was found around 2002 or 2003 or so. And I'm not precisely there, but it's around 2002, 2003, 2002, 2003, and it's found in China. Uh, as we've seen it here, coronavirus is a family. Is a family. Is a name given to various kinds of viruses. So we are going to see whether COVID-19 is among the viruses, and it shows symptoms of severe illnesses, severe acute respiratory infections ranging from common cold to more severe diseases. Okay, let's go. Now we are into COVID-19. Then what is COVID-19? COVID-19 is the infectious disease. When we say infectious meaning high tendency of passing from person to person. That is spreading from person to person. When we say infection is infectious, meaning it can spread within a twinkle of an eye. So it's highly infectious. It is caused by the most recent discovered coronavirus, meaning COVID-19 is part of the family of coronavirus. The most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. Coronavirus meaning COVID-19 meaning coronavirus identified in 2019. That is how I name it. So COVID-19 is a family member of coronavirus. Coronavirus is a bigger family that engulf most of the viruses. If you can remember, we said we have a Middle East coronavirus and acute respiratory infection coronavirus. So let's go. And what are the symptoms of COVID-19? The most common symptoms of COVID-19 are as follows: fever, somebody who comes down with fever, tiredness, feeling joint weakness, and dry cough. Dry cough, not productive. When we say dry cough, is coughing that doesn't produce sputum or mucoid. And some patients may have aches and pains, nasal congestion, running nose, and sore throat. These are the common um, causes, symptoms of coronavirus. Okay, then please note, most people, about 80%, recovered from disease without needing special treatment. These are um, the aspect that people get the relief. Most people, about 80% of people, get relief without treatment. Around 1 out of 6 of people who get COVID-19 become seriously ill and develop difficulty breathing. Meaning, if 6 people get been tested positive, out of these 6 people, only one that can be very, very serious and goes into respiratory difficulty. And this case mostly affects older people and people with underlying condition like a problem with high blood pressure, heart problems, diabetes, are more likely to develop serious illness. Younger people, I'm not saying it cannot affect younger people. It affects younger people, but it might not be serious, so serious compared to older people, and especially people, even though you're older, if you don't have this complication like high blood pressure, like heart diseases, and stuff like that, you might not come out with you might not come out with the respiratory difficulty. And people with fever, cough, and difficulty breathing should seek medical attention. Please, you have to, if you are experiencing fever or difficulty in breathing or coughing, immediately try and seek for medical attention in order for you to be evaluated as early as possible, because early diagnosis lead to early treatment. Then how does this spread? The main way the disease spread is through respiratory droplet expelled by someone who is coughing. Somebody that is somebody that is positive and is coughing, is sneezing, it brings out this some water, let me call it water, some small small droplets from his mouth or from his nose, and these are the things that is it will be present in the environment. So unfortunately, if you touch it with your hand and unhygienically you use it and you touch your eyes or your nose, you can infect it. That's why it's very, very important for people to 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 be distant and to practice high hygiene, washing of your hands regularly, especially with running water with soap, and rubbing your hands with alcohol-based sanitizer. The risk of catching uh, COVID-19 from someone with no symptoms at all is very low. So if somebody uh, is positive, quite alright, is positive, but has no symptoms, so the risk of catching it is very, very. We're not saying that you're not catch it, somebody is not going to catch it, but the risk of catching it is very, very low. So no matter what, try and practice uh, advice given by specialists, especially from World Health Organization and from related bodies that control or monitor this pandemic. So now let's look at the global issues of this coronavirus disease, COVID-19 outbreak situation. as from today, the time of recording this video is 14th of April 2020 at around 3 o'clock. The confirmed cases stand to be 1,812,734 confirmed cases, people that have been tested positive. These are the total number of them. And confirmed death, those that lost their life from this issue, may their soul rest in perfect peace. Stands to be 113,665. And then countries, areas, and territories which affected are just 213. And we're not praying this country to pass this number. And we are also praying the number of cases, the number of deaths should not pass these numbers. As I told you, this is a health is well channel, and if you are new to this channel, please consider subscribing and hit the bell icon notification in order for you to be notified whenever we release a video of this nature. And if you find it very interesting, please consider sharing it to your family and friends for them to be well educated on this pandemic, and also on how they can stay safe. This is the end of our today's presentation. Hope you guys enjoy the lecture and you should remain safe. Please, safe distance is very important. Practice hand hygiene and also eat a balanced diet. Bye bye. See you on the next topic.